All right, so we are looking at malaria in pregnancy. All right, malaria in pregnancy. So for malaria in pregnancy, we're just trying to look at, okay, if a pregnant woman gets affected by malaria, how could it be like? Of course, many disease conditions that could be normal to us human beings that are not pregnant could be more complex in pregnancy. Now, this is because a pregnant woman, there are a lot of changes in the system, including the immune system is no longer that strong, and more so, if she has an issue, it can affect the baby. Do you understand? So, malaria in pregnancy is a major public health challenge, mostly in sub-Saharan Africa. Now, this is where we have, all those bush, the economies are not really high, you have all those waters that favor the, growth of these mosquitoes. So it poses serious risks to the mother and the baby. Of course, that's what we are focusing on. But with proper prevention and treatment, right, the outcomes can be very much more improved. So why pregnancy increases risks? Pregnancy reduces immunity. Do you understand? So women that are pregnant, their immune system is very much more weak. Do you understand? So they are prone to a disease condition that me and you will handle it normally. There's a way their their whole system is so much affected. So it's more dangerous. So the parasites can sequester in the placenta, disrupt the nutrients reaching the baby, also disrupt the oxygen reaching the baby. You know that malaria parasites breaks down red blood cell. So imagine blood is not reaching the baby sufficiently. You understand? So what's the health impact on the mother? She's having anemia, she's having an increased risk of miscarriage, she's having higher chance of dying during the pregnancy because malaria is stressing her, the pregnancy is stressing her. Do you understand? So on the baby might be born having a low weight, okay, and they might be born before the time for delivery. All right, the baby is born and it's stillbirth, okay, and congenital malaria. So diagnosis is all those rapid diagnostic tests, right? Placenta blood smear. They just want to identify the parasite, okay? Treatment is if the malaria is uncomplicated, you can use drugs like quinine, clindamycin, artemether, lumefantrine. Do you understand? If the malaria is so severe, they now have to give all those intravenous artesunate, and such a woman should be kept in the hospital for monitoring.